My name is Randy Bigley. Joining me on the podcast right now from ADAMH, Brad DeCamp. Good morning, Brad.
Good to see you as always, Randy.
Same here. Same here. We can see each other maybe like once a month. It seems like, doesn't it, or something like that, or
As long as we have our eyes on it, right?
right? Exactly.
Yeah.
I have to, or you look like a big blur.
Yeah.
You know that? Yeah, that just happened too a few years ago.
Yeah. I've noticed it more, and I have to have them for reading. I can actually see far away, but if I don't have them on anymore, and it's interesting because they help, but it's like then when you don't have them, you're almost blind.
Like when you go into a store, I don't have my
Yes.
I don't have my glasses. I can't read I'm like you. I can read far away.
Yeah.
But when it comes close, like, what's that say?
Like, I know I should really be checking the carbs and the cholesterol on this, but I can't see.
I can't. So it doesn't count, does
That's
it?
right.
That's right. So let's talk about 988. That's coming up in about 2 weeks.
Yeah. So 988 started actually a couple years ago, or at least the idea was that this would be like a new 911 for suicide prevention, and so we have been working within the state of Ohio and in our local communities to get ready, and it's really been a process that's been driven from the federal government down. So we've been taking our lead from the State Department of Mental Health and Addiction Services, and it's going to go live July 16th.
Oh, wow. Yeah.
So we're fortunate in that the provider that was designated to us is one with whom we're familiar. So that's Pathways of Central Ohio. They've been working in the Marion County area for almost 3 years now, and have been coming into Crawford County a little bit more over the last year and a half or so.
Okay.
So the reason I say that's a provider that's known to us is because there are some counties where the call center is not going to be local to them. So it'll be a situation where they may not be as familiar with the resources, and obviously when you're dealing with a suicide or crisis situation, you need to have that information right at the tip of your fingers.
Sure.
So the other issue is overload, because if you have a call center that is in your community and another county doesn't, they may be calling your center, and that could overload your call center too. So it's a great opportunity. I think it'll be a good thing once it's up and running, but I think that there could be some bumps early on, so hopefully we can be nimble and work through those.
And this is 24/7, right?
24/7, and again, it's meant to take the place of some of these other suicide prevention numbers that are longer. Again, it's that whole concept of knowing those 3 digits, the 988 instead of the 911. So, but yeah, for crisis services and the suicide prevention and hotline, so that's what it'll be.
Is this one that's texting's available too? You can text?
They're working on the texting
Okay.
functionality, so yeah, they will have that up. That will not be something that will be ready for July 16th.
But that's coming in the future then?
That will be coming in the future, so they're working on the technology for that, and that's a good question, and something that people will be able to do. That's at least the goal.
Oh, good. Because a lot of teens don't want to talk; they just want to text these days, right?
Well, and we've been sponsoring the crisis text line, which is texting the number 4 and the word HOPE to 741-741. That's still active, and you're right. A lot of the teens is who really uses that. So,
wow,
yeah.
That's cool. So you'll be able to text, and if you don't want to talk to somebody, you can just text it.
That's right. Yeah, ultimately that's the goal, and
Good.
I'm sure they'll have some information leading up to when that will be operational.
Good. Good. That's going to be very, very easy to use. 988's easy to remember, like 911, and because I know there's probably a lot of people that have called 911 when they don't know where to go.
Exactly.
Right?
Yeah. And we do see that a lot of times. It gets kicked over to law enforcement when it's more of a mental health or maybe a substance use type of issue, and people just don't know who else to call.
Wow, very cool. Crisis services.
Yeah, so that's tied very closely to 988. So we have been partnering with what was Community Counseling Services, now Community Counseling and Wellness Centers, since they've merged with MAC, and so we're going to be continuing our partnership with them, but we're kind of beginning to think about what do crisis response look like at the community level, because the kind of the companion piece that goes with 988 is this notion of mobile crisis response, and so we're starting to look at what that looks like in both Crawford County and Marion County, and so I can't say that we've got a definite answer for what that's going to look like just yet. And again, we're going to continue to partner with community counseling and wellness centers moving forward. But as 988 evolves and moves forward, we're going to be looking at what we can do to, instead of having a deal where maybe you have a crisis, you call 988, and then they tell you to maybe come in the next day. It could be something where the services then go out to the individual or the family and are provided there.
Okay. It's all kind of tied in with 988. So.
Yeah, it's a fluid piece, and one of the things that communities across Ohio are being pushed to adopt.
Cool. Prevention walk's coming up pretty soon too, isn't
Yeah, absolutely. Thank you for that. Yeah, so we've got the annual suicide prevention walk that's going to be September 24th at 9:30. And one of the things that we started doing a few years ago was having it at multiple locations. So what we used to do is have it in either primarily Bucyrus, but I think there was some maybe occasion to move around. But we're going to have it at 3 locations. So it's going to be, if you want to be in Bucyrus, it's going to be at the Vita Hospital. In Galleon, it's going to be at the United Church of Christ, and then in Crestline behind the police fire station. So there'll be 3 locations. There'll be individuals who will be lead there at each site to take you on the walk. If you do want to register, we are encouraging people to pay by check to and sending those to Marion Crawford Prevention Programs. The other thing we can do, and if you're going to be looking or interested, we'll have this on our Facebook page and web page as well, so the information will be there. But it's a great turnout. The funds typically go to fund the Signs of Suicide program, which is a program that's done in all the schools and in both of our counties. Community counseling has done that historically here in Crawford County, and it's just a good program that's able to work with students who might be at risk and then intervene with those kids as quickly as possible.
So help prevent it, get in there early, right?
Yeah. So that's what the proceeds for the walk will go for. Plus, it's always a good thing, I think, to talk openly about things like mental health and suicide. There's a lot of stigma that goes with that, but it's something that as a community we do, I think, become stronger for by talking about it.
You know, and I wish that would become more open because, you know, we talk about people that have physical maybe handicaps or whatever, but we don't talk about people that have mental issues, and I believe, you know, that's kind of the same thing. It's kind of a stigma that people are going to think I'm crazy, but it's not your fault. I mean, that's, you know, our brains are all wired different. The chemicals are different. I mean, it's, you know, things happen.
Things happen. People have traumas and different things that go on, and you're right. I mean, the mind and body aren't separate. If you think about it in terms of what people get for cancer care or diabetes, it's kind of this thought around long term that you don't really ever separate that engagement. It goes on, but for other things like mental health and addiction services, I think we sometimes have the idea that, well, okay, you've been in treatment for a little while, you should be good for now.
Right.
But yeah, you're right. It's just a completely different perspective.
Now, are you guys involved in schools a lot?
Yeah, we do a lot with the schools in both counties. We have done, like I said, the Signs of Suicide program for, I want to say, either 11 or 12 years, so it does precede my time at the board. But it's a program that we do. We also do, if they have referrals or need of other services, we'll certainly make ourselves available through our provider network as best we can. Yeah. So yeah, that's something that the schools need all the support that they can get. They certainly are very, very busy and have their hands full with what they have just on the education piece, but then there's certainly other issues that creep into that as well.
I think it'd be hard to be a teenager these days. I mean, there's so much more than when you and I were younger. The forms of bullying that's out. You know, the online version that wasn't there when it didn't exist when you and I were in school. But there's a lot more challenges with the younger generation these days, isn't it?
Yeah, and it seems like it's hard to stay in front of things. So really, what we focus on, kind of from a preventive perspective, is really that good parent communication, parent-child communication. Making sure kids know what to look for, what some warning signs are, and always, reinforcing good, strong boundaries.
Always take those warning signs serious, too.
Absolutely. Yeah, definitely.
Yeah, because so many times, I thought they were just bluffing. They weren't,
No, it's very serious. You have to treat it as such, and again, the open, good communication is the key.
Right. 988, again, that's coming up on July 16th, and that's the number that you'll dial for crisis situations,
suicide prevention, the hotline, yes. So that'll take on that role.
That's great. I mean, that's going to be I think that's going to be, people don't know what number to call. They have to when you're in a crisis situation, you don't have time to think sometimes.
Yeah, it's hard to remember 10-digit numbers, even if they're very simple. So.
Right, exactly. If someone is in need of services from ADAMH, what can they do?
Certainly, you can call Pathways of Central Ohio at 1-800-544-1601. We also have Contact Crawford County, which is 419-562-9010. I believe the Community Counseling Wellness Center's number is still the same. They're 419-562-2000. And if you have a concern or question, you want to talk to us at ADAMH, you're certainly welcome to call at 419-562-7288. Do
you have a website?
We do, yeah. It's I believe it's mcadamh.com. We are trying to update that regularly with events and other information.
Good. Brad, thank you so much for coming in.
Always a pleasure, my friend.
Same here. Thank you.
Yep.